So the Women's Health Initiative, it was the wrong hormones being studied in the wrong population of women. They essentially released their results to the media before they even had them published and peer reviewed. And they hadn't even gone through the peer review process, which we know is really important for studies. And so in the last 20 years, we realized that we know how to do it better. But unfortunately, the fear that came out of that study is still around today.
My name is Jeff Krasno, and this is the Commune podcast. Today, I'm joined by Dr. Amy Killen, a physician and entrepreneur bringing a cutting-edge approach to women's health. Now, Dr. Killen began her career as a doctor of emergency medicine, and over her years in the ER, Dr. Killen saw the effects of chronic conditions on her patients and knew that she could make a greater difference on people's health before they were in such acute critical conditions. So she's since moved into integrative medicine and founded the Humanot Health Clinic to meet people earlier in their health journeys. Dr. Killen is also an expert in women's health and offers a physician's view of menopause hormone therapies, as well as principles of holistic, healthy living. You can find more content like this at jeffkrasno.substack.com or send me an email at jeffk@onecommune.com. Okay, let's jump in with Dr. Amy Killen. What's your kind of short-term and long-range mission as Dr. Amy Killen right now, kind of within your professional life?
It's funny, I treat men and women in my practices, but over the last few years, I've become laser focused on women's health and women's longevity and kind of how we can do better because as you mentioned, so much information that's out there is for men. And so women are such different creatures that I want to make it more available for the information for women to know how to be healthy and for all of us to kind of learn from each other.
I want to ask you about a video that you posted a couple of weeks ago. So this was a video around, it's the best way to describe it is on how many people in the wellness community have been kind of Trojan horsed by the MAHA movement. And this video was subsequently reposted by the great senator of New Jersey, Cory Booker. And I think this thing has now millions and millions and millions of views. So I want to ask you, what's wrong with a cane sugar Coca-Cola or a dye-less Skittle?
I just think it doesn't make a real difference. I think that if we want to focus on health, we need to be much more big picture. And there's so many things that we should be worried about more than whether our Skittles has red dye. You could always avoid the Skittles if you're worried about the red dye, but you can't avoid the air pollution and the water pollution and the soil pollution and all the other things that are kind of happening behind the scenes. So I think that we just kind of got played a little bit.
Yeah, I mean, when I look around at healthy people, they generally don't eat Skittles or Fruit Loops or drink Coke or eat French fries, even if they are fried in beef tallow. So to me, while I actually support the work of a lot of the proponents to get chemical additives out of our food system, right? And I know you've been outspoken about that. I pointed out to many of my friends kind of in the MAHA world that this is kind of the product of the bargain that was made. And sometimes that falls on deaf ears. I wonder kind of what you think about that.
Yeah. I feel like that the environment really should be nonpartisan. Like I don't understand, I actually consider myself pretty centrist, even though I don't come across that way necessarily. But I worry so much about the choices that are being made by the higher ups, sort of trading dollars for environmental health and letting the big businesses buy their way out of having to comply with the rules now. And it's sad and it's scary. And I think that health it's reliant on us being vigilant about our environment.
There's very little separating human health from planetary health.
We cannot rely on businesses to police themselves. Like we've seen this. It's not a surprise that they want to make money and cut corners, and that they will do that whenever they can. So I do think whether you believe in big government or not, in some cases we do need to step in and make sure that the rules are being followed.
So in defense of HHS, potentially, actually I want to get your viewpoint on this. The FDA chair, Marty Makary, just hosted a public hearing focused on menopause. And a lot of the topics that were addressed were around black box warnings and vaginal estrogen. In some ways, kind of addressing some of the vestiges of the WHI from 2002. So I assume that you must have followed these hearings, and I'm curious to get some of your high-level thoughts.
It's overdue, and I'm very excited that this happened finally. I think that I really do think finally that box warning will get taken off of vaginal estrogen. We've been talking about it for years, but we know it's completely safe for basically everyone, and the warning that it gives you breast cancer and heart disease and dementia is completely wrong.
For folks that aren't aware of the black box warning and how it developed and, out of this, women's health initiative that happened kind of back in the late 90s and then early 2000s, what was wrong with that study and how did it lead to information that really suppressed the adoption of hormone therapy?
So the Women's Health Initiative came out in 2002, and it was, essentially it was the wrong hormones being studied in the wrong population of women. They essentially released their results to the media before they even had them published and peer reviewed. So they essentially came out to the media, they stopped the study, they said, oh my gosh, these hormones cause breast cancer and blood clots and heart disease and strokes. We got to get everyone off of them. And they hadn't even gone through the peer review process, which we know is really important for studies. And so in the last 20 years, we've realized that, that they did some things that weren't ideal. We know how to do it better. But unfortunately, the fear that came out of that study it's still around today. Doctors are afraid, women are afraid. And so, less than 5% of women over age 50 are currently taking hormone therapy, even though we know it's super beneficial.
When you say synthetic hormones, is that a delineation between synthetic and bioidentical hormones? Can you just untangle that a tiny bit?
Bioidentical just means the chemical structure of the hormone matches what your body would make. So estradiol is the estrogen that we all make, testosterone is the testosterone, versus the synthetic form, which is like, for instance, estrogen is derived from pregnant horses' urine. And it's a very different looking molecule, and it behaves differently in the body. Although it does bind the estrogen receptors, there are a lot of other kind of effects that are different than the estrogens that we make. So it's just bioidentical versus kind of non-bioidentical is the synthetic version.
And how do women know whether or not hormone therapy is right for them?
But once you've gone, 12 months without a period, you're officially in menopause. In menopause, your hormones are very low and flat. So it's pretty easy. Your ovaries have shut down. You're not making estrogen and progesterone in any significant way anymore. And so in that population, it's just about, kind of where you are. We could put you on hormones without even checking levels, although I do like to check levels because we know you're low. In perimenopause, which is, up to 10 years before menopause, so it can start as early as 35-ish, your hormones are pretty erratic during that time.
So my wife went through menopause, and she has a kind of a transdermal estradiol patch that she wears. But that's different from an absorption perspective from like vaginal estradiol, right? Am I understanding that right?
When we talk about vaginal estradiol, usually we're talking about this low dose vaginal estrogen. So, and the dose is important because if you put something in the vagina, if it's a high enough dose, it will get into the rest of the body. Just like if you put a patch on your skin, if it's a high enough dose, it will get in through the bloodstream and the rest of your body.
And what are the different methods of delivery for vaginal estradiol?
The most common one is just a cream that you can get. It's a pharmaceutical product, and it's, you can get it for like $13 on Costco or on one of the discount drug forms, but you do have to get a prescription. But there are creams, there's suppositories, there's rings, there's all different various pharmaceutical products, and you can also get it compounded if you prefer, if you don't want the dyes or the fillers or things like that in there. So you have lots of options, but unfortunately it is still a prescription. So you still have to have a doctor that knows about it and that will write you that prescription.
Is there a preferred method in your opinion?
I think my favorite way is, I think either just the prescription estradiol cream, which is a 0.01% cream. It's very inexpensive. Estrace is one of the names of that. That's the most inexpensive way. I also really like a compounded cream with what's called an allage anhydrous base. It's essentially like it's a base that doesn't have any gluten or soy or fillers or dyes, or like it's a very clean base. And it also has these properties where it stays inside of you better. It adheres to the vaginal wall. So that's a nice option if you can get it compounded.
And what are some of the symptoms that vaginal estradiol addresses?
So anything related to low estrogen in the pelvic floor. So for instance, vaginal dryness, pain as you get older and your vagina starts to thin. So sex is painful. You get yeast infections, you get UTIs, and this estrogen can help with that. It can also even help with stress urinary incontinence or incontinence, like bladder leakage that can happen as you get older when those muscles start to become like less strong. So it's really helping across the board with pelvic health for women, and it's super easy, super safe, and very cheap.
You put out an interesting Substack article talking about vaginal estradiol, and you made a comparison that I'd never heard before between vaginal estradiol for women and Viagra for men. How does that comparison hold up?
Yeah, they're actually very similar in the way that they work. You may not know this, but Viagra actually helps to keep the cells in the penis healthy over time. So it doesn't just increase blood flow. It's actually really beneficial for the sexual organs. Same thing with estrogen for women. Estrogen is helpful for keeping the organs healthy as well. And both of them, if given systemically, potentially have both brain benefits and heart cardioprotective benefits. And we've seen that in some of the literature on the PDE5 inhibitors for men, and dementia risk and heart disease risk going down. And then, certainly we know with estrogen that systemic estrogen is extremely good for women's cardiovascular health.
So let's talk about testosterone for a moment. When is it appropriate for women to consider testosterone supplementation? And am I right in saying that there is no currently approved testosterone for women at this juncture?
Yeah, in the US, there is no FDA-approved testosterone. And, so we'd have to kind of use it off-label. We could write it certainly, but we have to use it off-label. And, testosterone is different than estrogen and progesterone in women. It starts high at about age 20, 25, just like in men. And it just starts to kind of slowly go down over time. It doesn't like fall off a cliff at menopause. It just kind of slowly goes down. But oftentimes women, maybe in their 40s, it could be earlier, it could be later, will have some symptoms of low testosterone. Like classic symptoms are things like difficulty, low arousal, difficulty with libido, difficulty forming muscle, burning fat, lack of motivation to do things. And so those are some classic symptoms. And if you have those symptoms, you can get your testosterone checked. And as long as it's not high, it turns out that oftentimes testosterone is helpful, especially for the sexual side effects. So you could be 30 years old, you could be 50 or 60 years old, but if you need it, then it can be really helpful.
Got it. And should women worry about presentation of secondary sexual characteristics like facial hair and stuff like that with testosterone?
I mean, yeah, you definitely should know it's possible if you get too much testosterone. So we have to be careful and not take a large amount. We don't want to be dosing you. Men have about 10 times more testosterone than women do. So our doses are much smaller. We want to generally stay within kind of that normal physiologic reference range for women. And I will say that, I've had not myself personally, but I've had some like female singers reach out to me on social media that they take a testosterone and no one warned them that you could have a little bit deepening of the voice. And, that's one side effect from testosterone that doesn't go away all the time. So that's something that's pretty important. If you're a singer, you should be careful of that.
What's your approach to longevity, particularly as it relates to female longevity?
Yeah, I am kind of in the middle of both worlds. I try to pull from what I think is the best of both kind of allopathic medicine and integrative medicine or biohacking, whatever we're calling it. I think the main things for women are probably the main things for men as well, especially as we get older. Building muscle is one of the most important things. Another big one for me is just getting outside and like getting out in nature. I live in Utah, so I'm right on the side of a mountain, so I can go out and go on a hike. But that I find that for the mental benefits as well as physical benefits, that the time in nature, a little bit of sun, talking to the bears and mountain lions it does wonders for me. Those are, and then sleep is the other thing that I really focus on with myself. I was an ER doctor for 10 years before all of this. I quit in 2013, but I went 15 years or more really without sleeping much. And then I had twins and, just a whole series of things where my sleep was messed up. And when I started sleeping after I left the ER, like it was amazing. All of a sudden I lost weight, like in a good way. The inflammation went down. I just looked like a different person. And so I really credit sleep with a lot of that as well. So I prioritize that for sure.
Well, I certainly want to respect your private life, but I'm wondering if you are influential on your children in terms of your health protocols and your approach to health. And I ask you from kind of my own personal experience of my children never listen to me, but I'm finding that they rarely fail to imitate me. I'll sneak into their room to, collect 40 dirty dishes and, I'll notice that there's a meditation app on their phone and I'll kind of, feel a small sense of achievement there. So I wonder for fellow parents who are trying to raise healthy children, do you have any advice there? Because we want our advice to be explicit often, but sometimes it just doesn't work that way, at least for me.
No, I mean, my kids definitely do not listen to me when it comes to eating. They eat whatever they want. And that's, but I also try not to give them like any kind of weird, aversions to foods. I pass along my information. They follow me on social media. They comment, they know what I'm saying. I do think that when it comes to like physical activity and, going and being active and choosing outdoor activities and things like that, they have followed kind of my husband and I, and they're always out doing mountain biking or skateboarding or playing volleyball outside. So at least some of that has rubbed off on them, but probably the diet not so much.
They'll get there. Speaking of diet, there was one post that you made recently that spoke personally to me about alcohol consumption in middle age. Yeah. Your post was more specifically about women and alcohol consumption, but to speak for the Y chromosome here, we're having the same issue. Maybe for different hormonal reasons, I'm not sure, but my ability or my liver's ability to process ethanol seems to be diminishing by the day, and it's really changed the way that I live because I'm just simply can't get away with being a social drinker at all. And maybe that's good for me. But what's going on, with women and, can you have that occasional glass of wine and be okay?
Yeah. I mean, I still drink occasionally and I do understand it's poison, but I also enjoy the social aspect of it. And I, kind of just try to be careful, but several things are happening, are your liver, and I don't know if this is true for men, I didn't look it up, but the alcohol dehydrogenase, the enzyme that breaks down liver starts to work less efficiently as we get older. So that's what part of it. We also, and this part's true for men, as we lose muscle and we gain fat, we're actually losing body water because muscle holds a lot of body water. And so your amount of total body water goes down. And so when you drink, it becomes more concentrated in your body. Like even, same glass of wine is more concentrated in your body. So you may feel it more because of that. And because the liver is also slower to act. So there are several things going on, as well as some responses in the brain, some dopamine changes and such in the brain that just make it not as pleasant, I think, for a lot of us as we get older to drink.
Yet another reason to build more muscle.
That is, you can drink more.
That's not one that I've generally seen bullet pointed, but I might add it. You're right. I think that there's a lot of data that has come out recently that no amount of alcohol is good for you, right? But this is a balancing act, right? Between knowing yes that this is a carcinogen and it's toxic, and yet we know that social bonds and social connections are absolutely key to health and longevity. In fact, I've seen some people argue that they're the number one determinant for health. Yeah. So you're walking that tightrope, I guess.
Yeah, I think that that's such a good point. I think that certainly a lot of people don't drink and they're social and they're very happy and that they have no problem. We've all been in our houses too long, on our phones too much. Like we really do want to be more social if we want to stay healthy.
Yeah, I'm curious, how do you manage your social life? I mean, do you schedule social interaction into your life? I mean, you're a busy professional. You're raising 3 kids. Do you actually put it in your Google Cal, like time for Amy to socialize here? Or do you make a kind of special point of getting out for cultural events or community events?
I travel a fair amount for work. So at least, once a month or so, I'm going to like a conference. I know you and I have some coming up together where that's pretty social. Like we're out with other people and doing things. And when I'm home, I do try to see friends at least once a week, just go to dinner or go for a walk or something. Of course, I have my husband and kids are also my best friends. So I feel like it's pretty social just with our family. But I find sometimes if I'm on my computer for several days at a time, then I do feel like I just need to get out and put it away, go see some friends and like be normal because it is so important. I feel so much better once I do those things.
I interviewed this guy, Gabor Mate, if you're familiar with him. He's a trauma-informed therapist. And he said, Jeff, if you could map the entirety of human history onto one day, we lived communally for 23 hours and 54 minutes of it.
Wow.
And we evolve, our engineering evolves in relationship to our environment. So it would make some logical sense that we are truly actually wired for this kind of social connection.
I wish we would just kind of go back to like having like little commune and having your family or your friends and your mother and, all those people in one spot. I miss that, even though I was never really a part of it.
Essentially our genes are more or less exactly the same as our hunter-gatherer ancestor genes, right? But culture is incredibly fast to the point where culture has now, in many ways, hijacked our own genomics and uses it against us. And so that's often when people are very confused around health. I say, just ask yourself this question: how did I evolve? And try to answer through that lens.
Yeah, it's a great way of thinking about it. I think the way we move, the way we eat, the way we, certainly our ancestors didn't have everything right, and they weren't as perfect as I think that we kind of idealized their lifestyle at sometimes. But I think that there are certainly things that they were doing a lot better than we're doing.
Yeah. There was no vaginal estradiol back on the Serengeti.
There was no vaginal estradiol. That's true. And in fact, one of the, humans are one of the only mammal species, that go through menopause, where you stop making vital hormones like halfway through your life.
Well, I deeply appreciate how you move through the world. I think you disseminate a lot of information with a tremendous amount of clarity, but also with a bit of levity and humor too, because I think we all need a laugh right now, given the times. So thank you for everything that you do, and I hope that we can have future conversations here on Substack and hopefully in four-dimensional space-time as well.
Yes, thank you so much. It was great talking to you today.
Thank you so much for listening. For more Dr. Killen, check out DrAmyKillen.com. That's DrAmyKillen.com. Now, this conversation was actually live streamed ahead of release on Substack. And for more of my live stream conversations, my weekly musings on health and culture, and ad-free episodes of this show, head over to jeffkrasno.substack.com. Also want to let you know about our Commune course platform that contains over 3,000 lessons and practices from the world's preeminent integrative medicine doctors, health experts, and fitness, yoga, and mindfulness teachers. It is a repository of recipes for holistic wellness. So check it out for free at onecommune.com/try commune. As a reminder, the audio version of my new book, Good Stress, yes, stress can be good, is available on Audible, and you can also listen to it for free as part of your premium Spotify membership. If you prefer the old school analog option, you can purchase a book at goodstress.com and get a bunch of goodies thrown in, including $900 worth of courses with some of my biggest influences, including Dr. Mark Hyman, Dr. Zach Bush, and Dr. Gabor Mate. Of course, feel free to reach out to me directly with comments, questions, criticism of the constructive ilk at jeffk@onecommune.com. Okay, that's all from the Commune for today. My name is Jeff Krasno, and I'm here for you.